Hi, ladies and gentlemen. Welcome to this edition of the Cameroon Town Hall for Healthcare Professionals. I presume we are on our number 76th edition today. What a big milestone we have achieved so far. And today we shall be talking on a very important subject, which is chronic kidney disease in Cameroon. And we've brought one of the very, very great trusted authority to talk about this subject today with you. And it's really a pleasure to be here once again. I will be co-moderating the session with Dr. Kate. Dr. Kate, welcome.
Thank you very much, Elvis. I don't know if you can hear me.
Yes, we can hear you, Kate.
Oh, great. Yeah, it's really a pleasure to really be once again on the Cameroon Town Hall meeting for healthcare professionals, and I really look forward to a wonderful presentation. And, you know, at times we decry the paternalistic, way healthcare has been run for the past 100 years. And it's really great to see people who have lived experiences with some of the issues we are dealing with coming up to present, to really educate and to share what they've been through. And also bring that, I would say, I don't know if the right word in the US is client perspective or patient perspective to some of the disease topics that we see on the town hall. So I look forward to this session.
Certainly it's going to be an interesting session, Dr. Kate. Good to have you on set today again. We are also going to have Dr. Christelle, who is a co-moderator from Cameroon. Hello, Christelle, bonjour. Hello, Christelle.
Greetings, sir.
Hi, Christelle, good to have you. Are we together?
It's Mabel, not Christelle.
I think Christelle locked out, so there's
she locked out already. Yeah. Oh, Mabel, good to have you. I was trying to introduce Dr. Christelle, who is our co-moderator from Cameroon. And ladies and gentlemen, once again, if you are joining in, this is the Cameroon Town Hall for Healthcare Professionals, a platform that brings together healthcare professionals from Cameroon. We are spread across the world from different countries. Our reach is now 37 countries, and our number now is 1,800 participants who have at least dialed in once on the town hall. We are making progress every day, and it's always a pleasure to meet with you every fortnight. And let me hand over the floor to our chair, Dr. Monoken, to welcome you all. Hi, Doctor.
Oh, thank you, Elvis. And it's a pleasure having everyone here today. Today is a very special session. And the reason why it's special is because we get to hear about chronic kidney disease from the aspect of someone who has lived it and someone who have lived it and wants the best for every other patient. And growing up in Cameroon, you could really imagine what it means to be diagnosed with chronic kidney disease back in the days, and with little resources, and devoting all her life really to saving patients with chronic kidney disease. I know I told Ia some few days ago that I have known her work for more than 15 years now, like just observing, like being an observer of what an organization can do really to help patients. back in the days where dialysis was a death sentence in Cameroon, before the government even engaged in trying to provide hemodialysis for patients, which right up to now, we still have problems. Accessibility is a problem. Even for those patients trying to get finances to continue doing this for their whole life becomes a problem back in Africa. Having access to the different equipments that are there, even when they are there, at times they are non-functional, and getting to the point of creating an organization that really has helped multiple Cameroonians, especially those in the Southwest region and Northwest region, in order for them, and in Cameroon overall, in order for them to know about this, sensitize the physicians, sensitize the population, get to be with the patients. I think it's a wonderful job having her here today. I am truly thrilled. I personally believe this is one of the organizations that has made a lot of contribution really in fostering the care of patients with chronic kidney disease in Cameroon. Coming from someone who has been an observer and have seen what has been done. So Elvis, this is a big problem. Even in the US, you cannot believe chronic kidney disease, end-stage renal disease is the only disease that is actually, once you have it, you switch and become what we call you become Medicare coverage, meaning that you get access to elderly care when you are still young. And you have access for this to be covered because this has become, and this was ignited by the Congress and also supported by the Senate, showing you how important this is and how expensive this care can be. And there are solutions to this, which could be transplant. Transplant is not an easy thing to do, even to adopt in Cameroon. Cameroon has had 1 or 2 transplant cases done. And back home in Cameroon, the question is, how sustainable is this? The platform, are we going to always invite foreigners to come in and do what we call, I always call it parachute medicine and disappear. And at times these patients don't have anyone to care for them. They don't have a platform to be cared for. Now, really today, I don't want to take all your time, but I'm very passionate. I'm not a nephrologist in any way. I'm an internist and I'm an oncologist and a transplant oncologist. But it's very important for us to get to reflect on chronic kidney disease, which is actually a consequence of several other diseases that people may have. So today it's very important for us to know the work of the ER Foundation, what they have been doing throughout in Cameroon, in the US, and in Africa overall, what their goals are. And I would really encourage everyone here today who wants to partner in something that they can do to help these patients back home. So Elvis, over to you. I didn't want to be this long, but I think I had to say something. I'm very passionate about it. You're muted, Elvis.
You are the chair and you always have the privilege to have more time.
Not so, really. I want to say always, please. I'm a member like everyone else. You guys want to keep calling me this chair, but yeah. I'm very excited all the time to just be passionate about what is happening.
Great. Thanks so much, Muno. And we have Dr. Brian Tegomo. Hi, Brian. Welcome to today's session.
Yeah, thanks, Elvis, and it's great to be back. Really been a long time. I am really thrilled today as well. I think Dr. Mono has highlighted the thing. It's really great when you have personal stories from people who have experienced some of these challenges themselves, and sharing those insights is always extremely valuable. So I'm really looking forward to this presentation and the discussion afterwards.
It's really going to be an interesting discussion, Brian. You can imagine that CKDs represent a very significant global health problem now across the world, where we have almost a prevalent rate of about 10% globally. And if you look at the situation in Cameroon, I was trying to read to prepare for this session, and what really caught my attention was the fact that you expect that in the developed world, where most kidney patients are the elderlies from 50s, 60s, and maybe due to other comorbidities or risk factors like hypertension and diabetes and all that. But in Cameroon, we find now the younger population below 45 more and more coming down with chronic kidney disease. And the question is, why? What is happening? And who is paying attention? And today we are very happy that we have someone who is going to really just tell us on just how important it is to pay attention to education campaigns, awareness campaigns, and of course, early detection campaigns before even looking at what to do when you get to the end stage renal disease. I visited Kinshasa recently, and I had an opportunity to speak with some nephrologists, and it was astounding to know that a session of hemodialysis in Kinshasa cost $150. We are blessed in Cameroon. When I heard last time that with just 15,000 francs, you can now have your sessions continuously for a year. And this is just to tell you that in some countries in Africa, hemodialysis is still a death sentence. And even in Cameroon, I think there are still many patients that cannot afford to do their workup test and all that precedes hemodialysis. So at this point in time, ladies and gentlemen, once again, if you just dial in, this is the Cameroon Town Hall for Healthcare Professionals. If this is your first time, we meet every fortnight, and we always bring in experts to speak on topics that concern the healthcare of the people back in Cameroon. And our approach is always like, we want to see what is happening in Cameroon, what is happening elsewhere, how can we make the situation in Cameroon better? Today, we shall be having Iya Bekondo, and I'll have the pleasure to maybe let the chair introduce Iya for us to know who she is. Muna, will you want it, or you want Brian to do so?
Can Brian do that? If that's possible. If not, I would do it. I'll be honored to do it.
Great.
So what I would say is Iya, it's very important for us to know, I said it before, Iya has dedicated her life really to the service of patients with chronic kidney disease. And it's important to know where this all came from. She's herself a chronic kidney disease patient, a transplant survivor, and she was diagnosed with chronic kidney disease early in her life. And due to the support of family and friends and other organizations, she got to get a kidney transplant early, about 25 years ago. And the donor was her mom. And this has made her to be an advocate for all those who really do need, and those who are in need. And she has just dedicated her life to making this a reality back home here in the US, especially among underprivileged populations like African Americans. So for so many years, she's going to tell us about her work, what she has been doing, but I don't want to get the cat out of the bag early because she has done a lot. I've followed her over the years on social media. She has done campaigns. She has provided hemodialysis machines in Cameroon. She has been an advocate at different levels of testing. She has been an advocate for the underprivileged in Cameroon, in Africa, and back here in the US. And she has also been an advocate for testing and for screening patients, and also education on nutrition and many other things that we can keep going on and on and on and on. So she is presently undergoing dialysis, I may say so. And really, we are trying to advocate to African communities, Cameroonians, to be a donor also. We can all survive with one kidney. And it's really a goal. I want to talk about it. We can all survive with one kidney. We need just one kidney to survive. We need to have a culture of giving out, and also a culture of donating, which we don't. The Caucasian populations do not have a kidney crisis problem the way we do have in Africa. And we do have also a pool. I'm also a transplant doctor. We have a pool. Our histocompatibility complex is very broad. So it's difficult for us to find match donors each time we're trying to transplant organs as Africans. If we Africans don't get to the habit of donating, we're going to have problems even being recipients of those this donor. So here in the US, when you go to do your ID card, please indicate there that you want to be a donor. That's very important. You're going to, in case of anything, you may die saving hundreds of lives. You can donate your heart, your kidneys. You can actually donate your kidneys when you're alive. You can donate your liver, you can donate your cornea, you can donate multiple organs can be donated. So Really, that's Iya's goal and passion. I'm not going to talk about her educational career because it's going to keep us all here. I'm very passionate, and I've always been looking forward for the past 3 years, Elvis, that we've been carrying out the town hall, to invite her here. I told her one day, I just saw her pop into the town hall. I said, this is the day. So Elvis, I think I've not done a just introduction to Iya, but she gave me a very little thing to introduce her for, but I think she is she's a hero, which we need to emulate and get to also work with her and promote her organization. Thank you, Elvis. Over to you.
Thank you so much, Mono. I agree with you that if we want to introduce her in a very real way that she deserves, it would take really much of the town hall time, but I know how much work she has done, and all of us who know her here at the testimony we have all testimonies of the work we have seen the Iya Foundation do in Cameroon. And it's always a pleasure in the town hall when we have people who have lived an experience of a particular disease condition to come talk to us. The last time we had someone from Germany who came talk to us on sickle cell, and it was really amazing just to hear, you know, their own experience from patient perspective before being the knowledge expert perspective. So today, once again, it's a pleasure to have Iya Bekondo among us. Iya, you take it away from me. And she's going to do her presentation, and we're all going to listen. Then after that, we can now do a question and answer session. So you can share your screen.
You're muted. Your screen is shared, but you're muted. You can unmute yourself. But...
All right. Thank you so much, guys. You guys are too kind. I sit on the shoulders of all of you, of so many people. You know, the Iya Foundation is not a singular thing. You know, it's a teamwork kind of foundation where so many people have poured into it, and all the work we do is truly as a result of so many people. So Iya in itself means mother. So I feel like, you know, the Iya Foundation has birthed a lot of humanitarians, you know, in my lifetime. So I'm gonna go ahead and start. This presentation today, I have to say, it's not gonna be too focused on my own personal story. When I reached out to Dr. Mono on what to focus on, he really wanted for us to share the impact of the Iya Foundation, all our activities and what we've been doing. So that's what I'm really gonna focus on today. Okay. So we are the Iya Foundation, and we promote kidney disease and organ donation awareness. The Iya Foundation is a New Jersey 501c3 nonprofit organization that aims to save lives through kidney health education, awareness, early detection, prevention, and research. The foundation also raises funds to support in-need kidney failure patients and dialysis clinics. The foundation was founded in 2011 by kidney warrior, myself, Iya Bekondo, and the foundation has a registered branch in Buea, Cameroon, called the Iya Foundation Kidney Resource Center, our very first. And that's where we manage all our programs all over the world, particularly in Cameroon. So what's our vision? To see communities have complete access to healthcare and wellness for kidney failure patients. To see communities where there is an effective control and delay in disease progression of chronic kidney disease due to early detection. To be responsible corporate citizens that are committed to creating a healthy, positive, social, and environmental value for all our stakeholders. To create and maintain positive relationships with our local communities and collaborate with our partners to create kidney health impact. To promote ethical practices across our business activities to ensure that our employees and partners are treated with respect and dignity. Our mission. Our missions are to increase kidney awareness and organ donation, to reduce the prevalence and incidence of CKD in Cameroon, to improve the health of people with CKD and end-stage renal disease in Cameroon, to reduce the mortality rate of people with CKD and end-stage renal disease in Cameroon, to improve the prognosis of chronic kidney disease in Cameroon, to highlight the plight of kidney patients in Cameroon. Our objectives: to implement community health programs for kidney awareness, to implement community health screenings to increase early detection, to promote organ donation through sensitization, to improve access to dialysis treatment and care, to improve overall health and wellness in dialysis patients, physically, socially, mentally, and economically, to encourage and empower kidney failure patients, to train interested parties to become kidney health advocates, to increase kidney health awareness in the mass and social media platforms. So what's the ER Foundation in a nutshell? In a nutshell, the ER Foundation ultimately seeks to improve access to holistic wellness and quality kidney health services for any and everyone in need. So what is the inspiration? The inspiration is myself. So I am the founder, Bekondo-Granatella, and I am a kidney warrior for about 33 years. I was born and raised in Limbe, Cameroon, and I was diagnosed with nephrotic syndrome at age 7. The diagnoses were later upgraded to FSGS, focal glomerulopathy for all new medics. I did dialysis for about 5 years, both peritoneal and hemodialysis. Peritoneal is the home dialysis, hemodialysis is in-center. I first got my transplant in 2005 at age 23, and my mom, Rose Bekondo, was my godsend donor. My kidney lasted about 16 years, which is actually the average of most renal transplants in the United States. I'm currently back on dialysis as of October 2021, and I'm waiting for another life-saving transplant. I currently do dialysis 3 times a week for about 3 hours each session. I go Monday, Wednesday, and Friday. So when I'm not busy with kidney health and organ donation activities or being on dialysis, I work as a quality assurance specialist in the pharmaceutical and biotechnology industry. I can't believe people. Somebody will be calling like, okay. So here is the structure of the foundation, our organization. So we have a founder, we have our board, which currently is Dr. Wele Langwe and Mr. Joshua Leke. We are actually looking to invite new board members. So if any of you are interested, we would love to have you. On the ground in Cameroon, we have our project coordinator and our medical technologies, Mr. Jude Wenker, amazing. And we also have our counselor and patient engagement director, Bole Mesape. She's been with us the longest, amazing. We also have our volunteers who make a great impact and have a huge function in our foundation, being that we're a charity and solicit their help with almost every event. Ngek Clinton is the president, Mr. Ngek Clinton, and Ms. Hocho Sonang is our honorable representative for the volunteers. So what is our problem statement? Excuse me, I'm just trying to move this. Okay, thank you. So the increased prevalence of CKD and ESRD in Cameroon and globally is gradually becoming one of the top world's greatest public health burdens, along with other non-communicable diseases. This increased prevalence has resulted to insufficient resources to cater to the care and wellness of dialysis patients in Cameroon. Frequent issues include supply shortages, insufficient dialysis treatment, and disruption of dialysis sessions. CKD and end-stage renal disease has gained its wings, partly because of the limited annual routine testing of the average Cameroonian, causing an end-stage diagnosis or detection of the disease, meaning that it's kind of like a slow poison where people are often diagnosed of chronic kidney disease and end-stage renal disease when they're already due to start dialysis. So majority of patients with end-stage renal disease are at poverty level and thereby struggle to maintain and manage treatment and overall wellness. So what are our key programs? One of our popular programs, the EA Foundation Green Campaign for Kidney Health and Organ Donation Awareness, which occurs every March. I'm sure a lot of you have seen us in March wearing green and all over the place. Maybe you've seen Dr. Wele Elangwe wearing green 31 days in March to promote kidney awareness and organ donation. So that's one of our very popular programs. We also have the community health screenings, which ties very closely to the Green Campaign. The Green Campaign is just different because it happens in all of March. So it has a little bit of special attention, but all through the year, we do have community health screenings in different localities, different communities around Cameroon, and really across different nations. We also have one of our very impactful and successful programs, the Food Security Program. The next program is the Genesis Fund, which is our financial assistance program. And we have our mental health and patient engagement program, which is also one of our very impactful program when it comes to the dialysis patients themselves. So the Green Campaign for Kidney Health Awareness. The Green Campaign is a global awareness and sensitization program initiated in 2012 by myself to promote kidney health and organ donation awareness. The event is a month-long campaign every March, during which a series of kidney health screening exercises and seminars are conducted across communities around the world. The program in the past 8 years has been implemented in communities across the Southwest region, Central region, Littoral, and Northwest regions of Cameroon. The impact extends beyond these regions through our extensive national media tours, billboard adverts, and massive social media presence. World Kidney Day is also celebrated every second Thursday in March and is commemorated by a kidney walk and awareness program. On this day, the foundation and its partners and supporters share pictures of themselves in green across social media platforms to promote kidney health awareness. So what's the projected outcome of the Green Campaign? For one, again, one of our objectives to increase awareness of chronic kidney disease and end-stage renal disease, to promote kidney health education and awareness, to increase the number of early detection. As we all know, early detection, any illness when discovered early has a better survival rate, has a better rate of being treated than when discovered at a later stage. To increase the number of detection of high-risk factors like diabetes and hypertension. So we've had quite a number of individuals who have discovered only during our activities that they were hypertensive or diabetic. So to highlight the plight of kidney failure patients in Cameroon, and of course, to raise funds that help manage our programs. So the 2023, this March, our 2023 impact is as follows. Our outreach extended to 6 communities, including 3 high schools. Approximately 597 participants were screened for kidney health. We partnered with the Gray Lab, which added so much value in this year's screening, because they brought with them a new device, a point of contact device, where we were able to at the spot, check for patients' creatinine and their EGFR. EGFR is the measure of kidney function in the body. So that made a significant difference in our screenings and data analysis. So our social media outreach, particularly Facebook, was about 75,296 participants. So when you go to Facebook, you're able to pull your analytics, and this was our reach for the month of March, which really was amazing. Approximately 425 people participated during our kidney walk on World Kidney Day. This held in Boya. Between 2020 and 2023, almost 7.5 million francs CFA has gone towards organizing the Green Campaign for Kidney Awareness. This year's Green Campaign was successful thanks to the partnership of the Grey Lab and Coach Obi for the fitness. So yeah, although we have the Green Campaign, like I earlier mentioned, specifically in March, year-round, the EA Foundation is always open to partner and collaborate with communities, groups, and other organizations around Cameroon or anywhere to promote kidney awareness and screen for kidney health. Invite us to your meetings, sports events, conventions, church events, whatever you have, and we would be more than willing to show up and do a screening, a health screening. You call and we show up. The past 3 years, we've impacted more than 20 communities across Cameroon. Some of the regions, again, are the Southwest, Central, Littoral, and the Northwest region. We look forward to increasing our scope and outreach. For this year, since 2021, we've expensed approximately 534,000 CFA to local community health screenings. So usually we do this in partnerships with other organizations or with sponsorships from an inviting group. So our cost hasn't been too expensive. Community kidney health screenings impact. This is just similar to the Green Campaign of awareness and early detection and education and sharing the plight, and again, fundraising. So next on our list is our food security program. 2 years of interaction and engagement between the EA Foundation Kidney Resource Center and dialysis patients in Boya, Cameroon. Our team discovered that majority of the patients did not abide by their renal diet. As most of you medics would know, when you're on dialysis or when you have chronic kidney disease, end-stage renal disease, you have to be on a strict renal diet, low sodium, low potassium diet, high protein, and all that. But we came to realize that a lot of patients, let me just continue. Due to the heavy financial burden of managing their health on dialysis, patients were left with very limited resources to cater for good food, and so would eat whatever was available, disregarding the nutritional value, which could be harmful. If we think about potassium, phosphorus, albumin, sodium, and other factors that can easily be influenced by diet when on dialysis, high potassium could be deadly as it could potentially stop the heart. Hence, the EA Foundation Food Security Program was born. Patients are provided with food items quarterly to help lessen their financial burden and also provide them with nutrition, education, and meal plan guidance. These items are basic staple items in most Cameroonian homes and are meant to extend to patients and those in their households. Since its inception in 2020, we've had 10 editions of the Food Security Program with 60 to 70 patients benefiting each quarter. Items often shared include rice, eggs, beans, spaghetti, oil, chicken. So perishable items are often avoided due to lack of means of preserving. I have to say that we have collaborated with Greenhouse Ventures, and in the past, several quarters, they've been very kind in donating to us vegetables. They've donated bell peppers, they've donated tomatoes, which has gone a very long way to our patients and their caregivers. So kudos to Greenhouse Ventures. So our food security program impact. So as a result of our food security program, there is food availability. Our patients and their caregivers have sufficient quantities of food supplies that is available on a consistent basis. They now have access to nutritious food or are able to balance it out with their own resources to make their food at home balanced, to make their meal balanced. Food use. Education on appropriate use of food as nutrients in a renal diet. Through this program, we empower, we educate, and we encourage our beneficiaries. During each quarter, when we give out our supplies, we usually have an educational session where we educate the patients on the different nutrients, on what kind of meals to eat, what is high in potassium and all that, and how to manage and control their diet so that they're not at risk of getting sick while on dialysis. So we're actually hoping that soon we will be able to collaborate with organizations like the United Nations World Food Programme. Between 2020 and 2022, approximately 4.1 million francs CFA has been spent on this project. Due to budget constraints, the last edition of the program took place in March of 2022. So we would actually like to find partners or sponsors who can help us continue to keep this program. The patients, as you can see from the pictures here, it's always a bank. They always look forward to eat. And, you know, it really was it has been a very successful program for us. Next on our list is the Genesis Fund, which is a financial assistance program. So this Genesis Fund, it was named the Genesis Fund in 2021, but note that we've always had a financial assistance program from onset when we started. The Genesis Fund was initiated in January 2021 to help pay for dialysis sessions for patients who were in desperate need. It was named after a patient member of the Kidney Resource Center called Genesis, who passed away because he couldn't get access to his dialysis treatment. Unbeknownst to our team, sadly, we only found out after the fact. The fund was later extended to also help pay for patients who need assistance with getting their vascular access for dialysis treatment. So what is our impact? As of its launch in 2021, 11 patients have benefited in assistance for their dialysis treatment, which totaled about 1.8 million francs CFA. We've also had one patient who benefited for their vascular access. The hospital gave them a discounted rate of 150,000 francs CFA, and we paid for that. The program is based on the availability of funds, which is mostly provided by freewheeling donors. Hopefully, with the unfolding of the universal health coverage, there will no longer be a need to pay for dialysis sessions. However, patient needs like the vascular access may still be catered to. This program meets our objective of improving access to kidney care and wellness. I think in 2017, we actually spent about 8 million francs CFA, where that was a big project for us, where we paid for surgery for about 15 patients for their vascular access at the Boya Hospital. We had to have a surgeon from Yaoundé come to Boya to do that surgery. So next on our list is mental health and patient engagement program. So almost all dialysis patients in Cameroon struggle with their mental health. Some of the mental health conditions we see include depression and anxiety. Understandably, this is as a result of some of the following: lifestyle changes after your kidneys fail and you need to get on dialysis, like eating restrictions, unemployment, insomnia, financial burden of dialysis, and wellness in general. Let me state here that dialysis in Cameroon is about 5,000 francs CFA per session. That's approximately 40,000 francs CFA per session. That's just the standard, just for dialysis. Now with dialysis, a lot of us suffer from chronic anemia. So a lot of people would have to be on erythropoietin, or like in Cameroon, they might have to, go seek for somebody to donate blood to them so that they can get blood to help with their anemia. Some of the patients feel like a burden to loved ones. Being diagnosed with dialysis and being in Cameroon, it's very scary sometimes, especially when patients have to go through periods of time when there are no supplies. They don't know when they're going to get dialysis. Sometimes they don't have the finances to pay for this treatment. So they don't know if they're gonna wake up tomorrow. They don't know when they're gonna go, if today is gonna be their last day. So the fear of the unknown drives really home to these patients. I mean, if you've ever been in Cameroon and have walked into a dialysis center, you would be very sad. It would put a lot of things in perspective for you. It would make you reflect a lot. A lot of the people, even here too, I mean, if you come to the dialysis clinics here, a lot of people, it's just a very miserable and sad environment for the most part. So it plays a lot on people's psychology, on their mental health. With that being said, we've been able to combat this through the following program: individual and group therapy sessions of the dialysis patients and even their caregivers, weekly education on end-stage renal disease and what to expect after starting dialysis. A lot of patients, once they are diagnosed, they don't know what to do. They're so scared, they're worried. But once we are able to reach out to them, our counselor and therapist, Mbole Mabel, is here. She does a great job at our center. She does weekly education on end-stage renal disease, coaching of dialysis patients to become their own health advocates. So as we teach them about the illness and understanding the illness and how to take care of themselves, they are better equipped to be able to share knowledge about kidney health to their family and friends. So we also have monthly patient support group meetings to discuss and share their individual experiences and coping mechanisms. This is also a good one, highlighting the patient voice by giving them a platform to share their kidney story, which also helps to promote awareness. So we have a few programs. We had a day in the life of a kidney patient program. We had Patients of Kidneyville, where it's pretty much where we interview patients. Jude, who is also a medical technologist and project coordinator, he's a great media personality, and he does all these videos that we share the patient story, we give them a voice, and they are able to advocate, and share awareness on our social media platforms and to their different groups. So what is the projected outcome? To provide vital psychosocial support to dialysis patients and caregivers, to improve mental health of dialysis patients and their caregivers, to increase patient engagement, to educate, empower, and again, encourage. What is our impact? We visit the Boya Hemodialysis Clinic 3 times a week for seminars on different kidney health and mental health related topics. Since its launch, we've had about 29 sessions of the patient caregiver support group meetings. We've had an average of 12 patients meet during those monthly meetings, which has come a long way for us. I remember when we started the Kidney Resource Center, I think in 2019, and we could barely get patients to come. They still did not understand the value of these meetings, but now we've come a long way. I think about 98% increase, which is quite significant. Patients look forward to the support group meetings and they are always present. As you can see, these are some of our patient group meetings. An average of 60 patients and caregivers benefit per week from group counseling. 7 patients have come back for individual counseling for one-on-one. For empowering the patient voice. So far, we've had 7 patients that have shared their story on our social media platforms. This is an ongoing project where we try to feature a patient either monthly or bi-monthly. If you go on our website, we have Humans of Kidneyville, where we've shared several patient stories, patients and their kidney stories. So we have about 98% of increase in patient engagement. This is Bole with the patient here. This is our dialysis center, and this is some of our group sessions. And this is where we are at the clinic, at the hemodialysis clinic in Boya. So when we talk about budgeting, the following chart is a snapshot of approximately what we've spent in the different programs in 3+ years. 3+ years meaning starting from 2020 to now. So our operating cost is the majority of the budget. We spent about 50 million. We've spent about 50 million francs CFA. Our green campaign has cost us about 8 million francs CFA. This is just for 3 years. Our food security program, about 4.1 million francs CFA. Our Genesis fund, about 1.8 million, which is about 29.5 million francs CFA total. So our partnerships. Sorry. I don't know why it's on. Bear with me. Okay. Move this here. Okay, so we've had some very amazing partnerships and collaborations throughout the years. Beside our staple partners, the Boya Dialysis Patient Association, the Ministry of Public Health, the Boya Regional Delegation of Public Health, the Boya Hemodialysis Clinic, the Boya Delegation of Women Empowerment, and the Boya General Hospital, we've been fortunate to collaborate with other amazing organizations and groups. Recently, we've partnered with the Gray Lab and the My Kidney, My Life Foundation in some community health events. We had a successful event in Bamenda with My Kidney, My Life Foundation in December of 2022. The report can be found on our website. And I just want to state here that if you go to our website, the earfoundation.org, you're going to see reports on all, not all, but almost all our activities where we've gone to different localities and different communities around Cameroon and in different countries and even in the US. So find some time and check out our website. So this was a 4 million francs CFA project in collaboration with My Kidney, My Life Foundation. Please note that this amount was not factored into any of our other budget expenses. We've also had the opportunity to collaborate with the Gray Lab on several community health events around the Southwest region. The Gray Lab has added so much value to our work through the introduction of a point-of-care device that instantly checks for creatinine and estimates the eGFR. Thankfully, we were able to connect to one of the manufacturers here called Nova Biomedicals, and we're looking forward to working with them in the future to actually have this device at the Kidney Resource Center for our use. Student groups like the Boya Medical Students Association, Hero Cameroon, Christian medical students, Yaoundé, and the University of Buea Medical Laboratory Students Association have played a huge role in our volunteer programs, without which many of our campaigns and events would be lacking. So we definitely appreciate our volunteers and our partners. These are the logos of our partners: My Kidney, My Life, the Gray Lab, Ministry of Public Health, the Dialysis Center. And I have to say, we have a host of partners and sponsors over the years. We've had so many supporters, individual and corporate sponsors. So for the purpose of this presentation and trying to stay within this year and the last couple of years, we decided to limit that. What do we have on our pipeline? So again, going to the fact that a lot of kidney failure patients suffer from chronic anemia and are often in need of blood, we saw it fit that we could start a program where we could help patients get safe blood. So that's how the Blood Donor Safety Project was initiated. It was actually initiated by one of our program directors, who is a board member, Joshua Leke. We've been working very hard to put this project together. We had a project proposal, and thankfully, the Cameroonian physicians in the United States, the association, were able to fund this project for us for the next year. So this project, in the next slide, we're going to see how much it's going to cost us and how much this association has pledged to support us. The next on our list is, on our pipeline, is emergency housing project for displaced dialysis patients. So a lot of patients, especially in Buea, where we are, come from very far. Some of them are displaced because of the crisis in their regions, and some of them, just because Buea is the closest dialysis center to them, have to travel very far just to come for dialysis. So our therapist, Mbole, who actually interacts very closely, as we can see in our patient engagement program, discovered that that's the case with a lot of the patients. We actually, for several years, Pachumeta, he's actually of late now, the EAR Foundation supported him in so many ways, and he would come all the way from Bafoussam. Him and his wife would stay or sleep. They would stay all day in the dialysis center, even on days when they don't have dialysis. And at night, they would sleep in empty beds at the general hospital. Sometimes they would be driven away, and it's just so vulnerable. You could tell they were very helpless. And that's how this program was born. You know, the emergency housing project for displaced dialysis patients. We're hoping that we can even have a house or maybe an apartment, 2-3 bedrooms, where patients who are coming from far can stay there. We can have 2 buildings, can at least stay there and do their dialysis, maybe rotating with other patients. It would come very handy for patients. I think it would go a very long way. This is a noble patient. To be sick doesn't mean you have to take away your dignity, to go to the dialysis center and see patients laying around. You know, you're sick already when you're on dialysis. I can tell you that. Right after each treatment, you feel like you're gonna pass out. Sometimes I rush home starving, you know, and to have to not have a warm bed to go to is just really, really sad. I think that's a project that drives home. It's a very expensive project, but I'm really hoping that we can, you know, do something about it in the near future to help and assist some of these patients. So the Nyasasa Non-Communicable Disease Intervention Project is another project that was coined post one of our events. So we went to Nyasasa, I think last year. We were invited when the youths had their events, and we did a lot of screenings and discovered that there were a lot of high-risk participants in Nyasaso. So this prompted us to have a follow-up event where we would go back to Nyasaso and follow up on all the high-risk participants in Nyasaso so that we can help them keep up and maintain their health, and hopefully not have them get into CKD or even end-stage renal disease. Also, during our green campaign this March, we had some high-risk participants once again, where we're going to be doing a follow-up clinical lab on them to make sure that they're doing okay and kind of like guide them on lifestyle modifications so that they can better take care of their health, if they're hypertensive, better control their blood pressure, if they're diabetic, to manage their diabetes. As we all know, hypertension and diabetes are like the two leading causes of kidney failure. And so we want to make sure that they are trying to do what they're supposed to be doing, like reducing their alcohol intake, reducing sodium, reducing their sugar intake, their tobacco intake, and just really treating infections as they happen and not waiting them stay for too long. So we try to guide them on their lifestyle to help delay disease progression. So for our pipeline budget, the 1 year estimate for our blood donor safety program is 4.6 million francs CFA. So each quarter is about 800,000 plus francs CFA. And we would actually be collaborating with Lifeline, which is a nonprofit organization also out of the US, also has a branch in Cameroon. And their main objective is collecting donations, blood donations. So we are partnering with them to implement this program, and we're starting this June. We actually already started to collect names of donors. So June 14th is World Blood Donor Day, and we're gonna be doing a lot of sensitization and awareness on blood donations to galvanize participants that would eventually donate blood for our bank. So I already explained why we are collecting blood to help patients on dialysis so that they can get safe blood instead of last minute rushing to get somebody from the streets to donate blood to them. For the emergency housing program, the 3-year estimate is about 27 million francs CFA. We thought that we could have a year estimate, but we decided that it would be better to sustain the project and kind of have it for 3 years and try to raise money towards 3 years. The Nyasaso intervention program is about 2.3 million francs CFA. I have to also state that in several of our community health events, we've partnered with Americas. Americas has been very kind to us in donating prescription medications for hypertension and diabetes that we've been able to share with participants during our events. The post-green campaign assessment for high-risk participants is about 200,000 francs CFA. So what will happen is that we have a list of all the participants that were high risk. We've been calling them and scheduling them to come back in. So we're going to do a blood draw and assess their blood again in clinic to check whether they are still at risk or what's going on. I have to state here that at the Kidney Resource Center in Buea, we actually do have a small, modest laboratory where we're able to run tests for anyone, blood tests. The whole idea was that we would be able to monitor dialysis patients in Buea or from anywhere. We would be able to monitor their lab results closely, monthly, to better be able to help them so they can, live better lives so that they can be healthy and all that. For example, Monday is gonna be my June blood draw for the month. My dietitian is gonna tell me if my potassium was high, if my phosphorus was high, if my albumin was high, what my numbers are. That way I can either adjust or reflect and see. I struggle a lot with my potassium. A lot of people struggle with their potassium because potassium is in almost everything. You have it in your bananas, tomatoes, potatoes, all your green leaves, almost everything. So a lot of people struggle with potassium. So if your numbers are high, the dietitian will let you know and you'll be able to, revisit your notes and see what you're doing wrong and adjust accordingly. That was our intention to take this back home and do the same for dialysis patients in Buea. Unfortunately, due to the environment in Cameroon, we have been restricted from doing those labs. The administration in Cameroon is not really accepting. They want them to go to specific labs and do those tests. However, I would like to just beckon to the audience that, if this is something that speaks to you as medics, it's something that we would still like to do, maybe on a free basis, so that patients are still getting tested, so that patients are still getting to know their numbers, and patients are gonna get the adequate amount of help that they need to better help them manage their health and be well, relatively, while on dialysis. So this is a program that I would still like to do in Buea. The whole idea was that we would be able to have patients do those tests at a very discounted rate. It's going to help, I like to call the Kidney Resource Center as an enterprising nonprofit, where we would be doing some activities to generate revenue that would go back to fund the activities of the ER Foundation. Unfortunately, we haven't really quite been successful in that because of an example like the patients not being able to come and do lab work with us because they have been restricted to do so. So that being said, I just want to say that even though these are our pipeline projects and this is the budget, we also have our active projects which are ongoing. The Green Campaign is an annual event. It happens every year. So we're always looking for partners. We're always looking for sponsors and supporters. The Genesis Fund, we would like for it to always stay active. Right now, it's active, but the funds have already been allocated to specific patients. And once it runs out, that would be all. And this is because also, the universal health coverage, even though it has been implemented in Buea, there's still some confusion that needs to be sorted out before we would know for sure that they wouldn't be collecting any fees from the patients. The food security program, the last one was in March 22. I would like for us to jumpstart it again, to continue with that program. That program was a very exciting program, and I think it supported a lot of dialysis patients and their households, and I think, it was a great success. So these are ongoing programs that always need support. So. Did I double click? I'm sorry, I think I did. Okay. So when it comes to funding, you might be asking yourself, okay, how do we fund these programs? So we have a lot of our support that comes
Did we get, it's like she's frozen on her screen and video as well, Mono?
Yeah, it looks like we lost here for a while.
Yeah, and I think she's almost coming towards the end of her presentation. I hope that she's able to get back to us, but I think Brian, from the sofa with the conversation, I think you can have some reactions before we even get back here. Hi, Brian. Some thoughts around what are your initial reactions?
No, I think it's really great to see a patient talk about their personal stories and personal experiences. And I think these kinds of conversations are critically important as Cameroon is undergoing this very critical epidemiological transition, where we are finding more and more higher increase in the incidence of chronic chronic diseases in general. So we are quickly transitioning or shifting from a pattern of disease that's characterized by the infectious disease and malaria, TB, and tuberculosis and all those other infectious disease, and seeing more and more cardiovascular disease, hypertension, which are clearly risk factors for CKD. So I think this is something that needs significant attention, and there's something that we definitely have to work around. I was really impressed with her slide that you really showed some of the work they're doing around early detection. I think that's critically important, and the partnership she has in place. You might remember, Elvis, we had the president of the Gray Lab here a few months ago, who talked also about some of the things that he was doing in Boya, and just increasing diagnostic capacities and things like that. So I think those kinds of collaborations and cross-sectoral partnerships are critical for this kind, to increase this kinds of awareness. So
I don't even know where I start.
So I think we have Pia is back, and
yeah, don't worry, we're just reflecting about your presentation, so everything is going on smoothly. So if we can try to round up so that we have time for discussions.
I am rounding up. Yeah. Oh my God. I'm so sorry.
Please don't worry. We have been having a wonderful discussion and reflecting about the work you're doing.
You were on your last slide talking about how people could donate to the ER Foundation.
Oh, okay.
That was slide 29, I believe.
Okay. Yes. But where is it?
Yeah, so Elvis, what really, while here is searching the slides, what really drew my attention is the fact that once you get an organization which is created from a patient perspective, there are a lot of things that are taken into consideration that if you are creating this where you have never had the empathy to go through this whole process, you will not take into consideration. For example, if you look at the food security program, a lot of us don't think about that. A lot of us don't think about that could be a main concern for patients. If you think about just looking about the housing issues that these patients face, just those who live, I'll just take for the Southwest, those who live near Soso, those who live the interiors of, let's say, different areas in the Southwest and move over to Boya, come get dialysis. You can imagine what they're going through. You can imagine what these people go through in order for them to get dialysis. So it's really seeing that when a patient actually gets an organization, they think about other things. So over to you here.
Okay, so oh boy, I'm not gonna, trust me, I'm not gonna. So you might be wondering how we fund our projects. So a lot of our funding comes from public donations, from individuals, you and I. A lot of the projects are self-funded. I support a lot of the projects. We also have partnerships that support us. We've had some sponsorships. So 13.9% is from sponsors, 6.2% from scholarship, from partnerships, and public donations is 27.3%. And self-fund, I fund majority of the projects. But I have to say, we've given all through the life of this organization, we've given one Lifetime Achievement Award, and that's to Dr. Constance Eneme for her significant support throughout the years towards the ER Foundation and our programs. So we gave her an award, and we continue to hold her in high esteem and hope that we're going to continue to have more Lifetime Achievement awardees. So if you would like to support us, the information is out there. I know I'm actually running out of time. I just added this impact from 2020. We were very active. I'm gonna just read through this really fast just so we don't miss out. So we had a successful green campaign in 2020 despite COVID. We had extensive work on COVID-19 prevention. We had several hand wash unit distributions in several different centers, mask and sanitizer distribution. In 2020, we launched a food security program, a patient support, financial and service program. We donated 1 million worth of dialysis kits to the Boya Regional Hemodialysis. I talked about the frequent shortages. We had a massive free community health fair in Okola, in Yaoundé region, and that was a very extensive 3 weeks campaign. We had a great sponsor from Yaoundé, and it went a long way. We had prescription drugs worth about 94 million francs CFA from Americas, and we have, of course, our ongoing activities. Our outreach online was about 50,000 people. In 2019, I'm going backwards. In 2019, we officially launched the first ever Kidney Resource Center. It was launched then. We continue to have trainings and workshops for kidney health educators and advocates. We initiated our Act for Kidneys Holiday Edition, where we actually gave out care packages to dialysis patients in here in the United States. We went to several dialysis clinics in New Jersey and supported dialysis patients. We gave out about 150 care kits. It contained puzzles, blankets, and socks, something to keep them warm while they're on dialysis. We have also had life entrepreneurial and wellness coaching to patients, where we've been able to help them with small funding, small 50,000 here, 25,000, to help them start a business that can sustain them with their dialysis treatment. These are different programs that we've done pre-2021. We donated 5 dialysis machines to the Boya Regional Hemodialysis Clinic. That's worth over 70 million. I meant to put $70,000 rather. I have to say that it was rather unfortunate that these are the machines. It was rather unfortunate that these machines were not really utilized because the technicians were not trained to use these machines. And we tried to see what we could do. They just did not know. And these are machines that were donated to us by Dr. Badu. He's a nephrologist here. And he came and he actually donated some to Ghana. We worked closely with the Ghanaian Medical Association. I was in Ghana in 2018, and we carried dialysis clinics there. We were shown how they were being utilized. So I couldn't understand why we couldn't use them in Cameroon. In 2018, we also donated 1 million francs CFA to supplement Epogene administration to patients. I have to say, with that Epogene program, we later realized that Epogene was actually for patients. The only people who could afford Epogene were patients that already had money, patients that were already doing okay. So how are we supporting? Because they wouldn't administer Epogene to you if it was not sustainable, if you couldn't continue to use it. So we started thinking of other means to help the most vulnerable patients. So we subsidized dialysis fees of about 500,000 francs CFA patients during the month of December in 2018. And we continue to reach, to do our outreach on social media. So we've also been present in other places in Nigeria. This is just a continuation of our impact in Cameroon. We partnered with geriatric care in Nigeria to do a campaign. Why am I here?
So yeah, if you can wrap up, I think
I'm wrapping up. Well,
the audience will really have a lot to ask you as questions.
Sure, so. This is it. We also had a Hugs affair where we help us give someone hope. And it was an event, a gala where we raised funds. It also helped us to fund these activities. So this is just our different, I'm gonna post this on our website. You can take a look. We've been in Ghana. We've had events in the US, in Nigeria, and Sierra Leone as of recent. It might not be there. These are some of the pictures. 2017, same thing. We were in South Africa and Sierra Leone in 2017. And this is just our volunteer highlight. I've already spoken highly of the impact our volunteer has in the work we do. And I was gonna upload a video of, just a video of testimonial of what some of our patients are saying, but we can save it for next time. This is Dr. Welle during one of our trips to Cameroon. And this is our contact, for anybody who would like to reach us. We're in Boya. Our office space is in Fakoshi Plaza, and we're at Studio L, so you can call us, you can reach out to us. We would be more than ready to help you with any kidney-related questions or organ donation questions. So thank you, and if you have any questions, open to take them.
Wow.
Thank you.
Thank you very much, Iya Bekondo, for this very excellent and heartwarming presentation. You really have taken us through the journey of what a kidney patient actually goes through and what the requirements are. And as you might have to stop your screen sharing just so we interact with the audience. As Mono just mentioned a while ago, your perspective is unique because then you embody all what someone who has gone through something will want to tell the world. Look, if you are going into a program, you need to have a holistic view of that program. You've touched on really a holistic approach of how we can actually think about taking care of kidney patients from the nutrition perspective, from housing perspective, from mental health perspective and all that. So it's really been an engaging and really heartwarming presentation. Thank you very much. While we give you time to get some sips of water, I'll be taking around with the moderators to get, I already started with Brian to get their thoughts on your presentation. And now let me move to Dr. Kate. Hi, Dr. Kate. I know you are a diabetes, really a specialist, and you've done a lot of work on diabetes. And I want to ask you, Dr. Kate, after listening to this presentation, what are your thoughts about what the ER Foundation is doing, and also about what Cameroon is doing as far as patients with chronic kidney disease are concerned? Over to you, Dr. Kate.
Thank you so much, Elvis, and thank you. Great thank you to Iya for that presentation and really just showcasing the impact of what the Iya Foundation is doing in Cameroon. I think I've had the privilege to work with the Iya Foundation some years back within the context of the Christian Medical Student Association, and just really to extend the thanks of those students who participated in that program, because the experience and the certificates of participation they received from the Iya Foundation helped a number of them secure some public health training opportunities out of the country as well. So that also is part of the impact of what Iya Foundation is doing. And I think we've seen very clearly from your presentation that problem-based solving approach. There's a lot of talk, even within the research community today, about public patient involvement. And it's very different when, you know, as clinicians, at times we think we know the solutions to the problems of our patients and clients, but we could clearly see that all your projects arose or stemmed out of a particular problem that patients were facing in the process of their care. And then you're putting in place solutions to, you know, alleviate those different issues and problems. And so that was really lovely to see. And I think that's the approach going forward, even as clinicians and as researchers, that we need to adopt, because that's how we are going to transform society. So I was really glad to see that. Thank you.
Thank you very much, Dr. Kate. You are very right. Such a partnership between clinicians, the public, and patients is very important for us to holistically look at problem solving when it comes to providing healthcare to our patients. I think I'm not a nephrologist, but I would imagine that in your training as a nephrologist, you have not thought about housing problems for kidney patients. Okay? So you can imagine that a nephrologist who has a kidney patient in front of him will think about all the clinical issues, but will just ignore where the patient is coming from. Would not know if the tiredness of the patient is because the patient has traveled for a long distance or spent a sleepless night or has a mental problem, but we'll be focusing on just maybe, is it an increase in creatinine, is it an increase in eGFR and all those other things clinically, but ignoring some of those very important things which Iya Bekondo has really drilled us through. And so thank you so much, Dr. Kate. Let me move to Christelle. Bonjour, Christelle. Once again, what are your thoughts about the presentation? Did we have Christelle back? Not sure. Okay.
No, no.
So at this point in time, ladies and gentlemen, we have Muno Ken is going to give us his thoughts about the presentation once again, and then I'll hand over to Dr. Brian for the question and answer session.
Yeah, Elvis, as I was saying before the end of the presentation, once you get an organization that is created from patient's perspective, you get to really understand. I do deal with cancer patients, and one of my patients had asked me once when he was very mad about what I was telling him, do you have lung cancer? And I said, no. So that was a very important question to me, because I was telling her she has a lot of social issues. So I was trying to discuss with her why she's not coming for her treatment. And I got very blunt, and she also got very blunt with me. So she's like, do you have lung cancer? And I said, no. She says, you don't understand. And you're never going to understand it. So you would sit in your high horse as a physician and start telling me things to do, but you don't know what I'm going through mentally, what I'm going through socially, what financial constraints this is causing me, how I'm unable to take care of my family right now and the government does not care, how my medications, I've paid taxes in this country for so long and still my medications are not covered. There are people who migrate and come into this country and they get everything covered. I'm just giving you this bitterness coming from a patient. And as a physician, if I create an organization, I don't think I'm going to reflect all these things that is happening. Even the person who sits in the parliament or in the Senate trying to protect this patient is not going to understand till they get a patient's voice. This patient's voice is what is going to cause patient engagement and transformation in the health sector. And in any society, if you don't listen to them, you don't understand where this is coming from. So I feel what we got today was really how an organization can work in order to take care of all these problems, because the patient understands it, understands where this is coming from, how important psychosocial involvement is, how dealing with this, knowing that you're going to deal with it your whole life, can be a very difficult problem to deal with, even mentally, how you're going to go through this. And mental health in Cameroon is a big problem. We've talked about it so many times. We lack mental health specialists. We have housing issues. I don't think the government is going to be the solution to all of this. So, but I think, Elvis, I will not spend more time. I know there are a lot of questions, but this is really, it was a presentation about EA Foundation, but it touched all the little things that go on in Cameroon, like subsidizing, which we have actually praise the minister for going ahead with universal health coverage. But is it going to subsidize housing? Is it going to subsidize their labs? Is it going to subsidize their transportation? What are we going to do? And there was a question about transplant. Are we even able to do that? So we're going to reflect about the questions, Elvis. So that's just my little reflection. And I felt more, after listening to this, it gave me a level of hope but sadness about how far we need to still go.
Mhm.
Yeah, no, thank you so much, Chair. I hear you, and I'm sure that question from the patient to you was an awakening a call for us to see how important it is for us to provide patient-centered care when we are dealing with patients that are going through really hard times, especially with chronic kidney disease and other end-stage disease. So it's really a very, very great session, and I hope our participants are as engaged as we are all on this very presentation. Now is the time for us to ask Bekondo questions. You can indicate by a show of hand, and you say who you are, where you are dialing in from.
Yes.
And then Brian will be able to coordinate that and get all the responses.
All right.
And maybe like a Kickstarter, Brian, I wanted to ask Bekondo, in all this work you're doing and in all the presentation, maybe I didn't pay attention closely, but I wanted to see the intersection between your foundation and the Ministry of Public Health. Are you getting enough support from the Ministry of Public Health in your work? And are you also getting supports from the nephrologists or those stakeholders that are involved in other stakeholders that are involved with kidney disease in Cameroon? Or what is the level of engagement with MinSante and also with other experts?
So locally meaning Buea, we have a very close relationship, working relationship with Dr. Tewafi, who is the leader or the director of the dialysis clinic in Buea. We've worked with him for several years. We have an MOU of, an agreement on working terms, and we've worked with him for several years. He was at our walk last year actually and gave a presentation. We've always had a decent relationship. So also with Dr. Mukake, who is the director of the Buea General Hospital, he endorses our work and has always supported us. When it comes to dialysis clinic in other places, in Yaoundé, in Bamenda, they are always very receptive to us and whatever events or activities we want to do with them. However, Ministry of Public Health, it's just been such a bottleneck. I've spent several times trying to seek audience, even with the Minister of Public Health, and that's why I was so sad the last time that I didn't get a chance to ask my questions with him when he was on the platform. My bad, but we haven't been able to. We haven't been able to get any significant help from the Ministry of Public Health. We work very closely, with the Buea Delegation of Health, the Regional Delegation of Health in Buea. We submit our reports, our activities of our reports every month to the Buea Regional Health Delegate. So they're up to date with all our activities, and they support us, in just being a partner per se, but we haven't really had any significant support from the state or the government.
That's interesting.
Bole or Jude.
Yeah. That's interesting to know, and it's a very good thing to know that you have that kind of a collaboration with those in the Southwest or those in the Northwest and some of the doctors in Yaoundé. And we heard from the minister while here that there is a committee that is being created, and I was told recently, the chair informed me that The minister is already about to publish that communique, maybe through, they are waiting for some clearance from the Prime Ministry of a committee that will be in charge of the diaspora healthcare professionals. And that committee's role will be to help people like you to have the kind of access that you need in order to meet with minister or to get all the resources and help that the Ministry of Public Health can give. It is our hope that they match their word to action. And let's hope that you might have the opportunity to get such a collaboration, because you are doing amazing work, and it is but natural that the Ministry of Public Health should be a very trusted partner in supporting you with this work. I would hand over to Dr. Brian for the rest of the questions and answer session.
Yeah, I just want to invite people who have questions to raise their hands, or if you have contributions, you can just raise your hands and I will try to call on you. I just had a quick follow-up to some of the remarks that you made already and what Elvis talked about. Kade wanted to know more about if you have thought about institutional memorandum of understanding between your foundation and the Boya Regional Hospital.
We have that. We do have a standing MOU with the Boya Regional Hospital with Dr. Mukake, and we have one with Dr. Tewafiu for the dialysis clinic.
Yeah, that's awesome. That's awesome. Yeah, I think that's great, and I think the really some ways that the Ministry of Public Health could be of support. It's so some of the areas, some of the things that you think the minister would, some areas you think the minister would be most supportive. Some specific, parts of your organizations that you think would benefit from, working with the Ministry of Public Health directly would be very helpful as well.
Yeah.
Yeah, Brian, just to add to that, I think we should not, negate or neglect the fact that there is already a standing MOU with the Boya Regional Hospital, which is, of course, a very solid entity of the Ministry of Public Health. And that exists already, and probably, I don't know if you did mention that you do submit your reports to the Boya Regional Delegation of Public Health, which I think
do, and actually share them too with Dr. Mokake and Dr. Tewafiu too.
Exactly, I think that's the way to go, and you build from that, and that means that those activities, one way or the other, are transmitted, following the triangular, method of transmission of health data or data that is collected from the regions to the central level. But of course, I do understand your plight to want to also hit that central level connection, which I think probably will bring more visibility and probably put you also in line to receive certain other amenities that are, made available for organizations like yours. So, but I think that low-level kind of connection and institutional ties which you already have, it's a very strong and solid foundation.
Okay. Thank you.
Yeah, I see Henry Ndasi had a question about the, I don't know if you can just unmute your mic and pose the question directly. He wanted to know more about anything that's being done. Maybe this is not specifically for you, but anyone who is aware of anything that's being done with regards to kidney transplant in general in Cameroon. Henry Ndasi, can you, are you able to unmute and pose your question?
Yes, I am. My question is, I see a lot of effort being put into dialysis and caring for those patients. These patients would definitely require dialysis. Transplanting is these organizations helping these patients to be able to sustain their impairment should also look at the possibility of transplant, because it is not too complex. The most thing is the cross-matching, which can be done. When I was in Nigeria, it was being done in Sudan. It was not even done in Europe. And within a trial period where a surgeon came from the States, worked with a local surgeon, transplants were being done. So it is not a very complicated procedure once the cross-match has been done. So I think that's an area where we can start thinking about how to empower our community. We have big families here, so donors will not be a problem. That is just a contribution and a thought for the future.
I like how you say donors will not be a problem. I would beg to differ to that, but
Yeah.
that's for another day.
Yeah, that's a whole psychological discussion, because in Africa, we have not been trained to be donors. It's a cultural thing, and we've not been trained to be tested. And truly, it's a cultural thing that goes with all Africans moving abroad. And we have a very huge genetic pool, Africa. And a lot of people don't know that. It's not only about blood when you do HLA matching among Africans, we have the widest genetic pool that exists on Earth. And that makes getting matched donors really a big problem, which can be a big discussion for another day, but it's good for us to create. I think the government needs to have that also as a goal and try to, because we cannot be importing surgeons to come do it. We need to make sure that the medications that are going to keep these organs to stay in place are available and are also generic. I'm saying this from, I'm an oncologist, we do bone marrow transplant, which is the easiest transplant to do, but the most difficult to sustain. Meaning bone marrow transplant, I'm not going to encourage anyone to do it in Africa. I'm going to explain to you why. Just because post-transplant management is done in South Africa, but other countries that are not developed. It's so complex to manage because for all transplants, we have host versus graft disease, meaning the host is going to attack the transplant. But in bone marrow transplant, we have the graft versus the host disease. The graft is going to attack the whole body. You ask yourself, why don't we transplant all sickle cell patients in the US? Why have we not transplanted them all in Europe? All these years, it's just because the risk may outweigh the benefit. You need to select your patients well. Your transplanting process may kill them rather. And it's so important. I've been working even in the US, we transplant more Caucasians because the organs are just so available. The HLA matching is so commonly done. We do mismatch transplants now because we have a lot of technology and medications to sustain that mismatch transplant. But when you get to where I work, like in Cornell, our population is mostly African Americans, and you are going to be horrified by the side effects that we see that we don't see at Memorial, which transplants a lot of Caucasians. These are two hospitals in Manhattan, just opposite each other. One doesn't take all insurance, we take Medicaid and Medicare. So we tend to see those kind of patients, and we do allo transplant, cord transplants, and you tend to see what the horror is. If you're not really in the field of transplant, but in heart, liver, kidney is a bit different. It's a whole different story that we can do, and we can adapt, and we can really get to the point of doing it. But we do need engagement from the government. Cameroon has had I think one transplant took place in L'Hôpital Général.
Last year or last 2 years?
Yeah, nobody has communicated with us what is the state of the patient right now. I think the donor was a brother, but it's very important that and as we got from the doctor said, when you have a lot of siblings, you may be able to actually get a lot of matched donors. And your parents are always going to be haplo donors all the time. One of your parents, which can sustain a transplant between 12 to 20 years, depending on how much the rejection is going to occur over time. So that was just a reflection, but let me go to my question, Brian, if you permit me.
Yeah, sure. I will just to cut you. I was curious if HLA typing do you know the state of HLA typing in Cameroon? Is that a difficult thing to implement in Cameroon? Do you know?
It's not a difficult thing to implement like many other things. The state
successful transplants.
Yeah, it's not a difficult thing to implement in Cameroon, but like many other things, you need engagement from the government. I'll tell you something, the state of pathology, I'm a clinical pathologist trained in Cameroon. The state of clinical pathology in Cameroon is very rudimentary. The state of our anatomal pathology is rudimentary. We are unable to even do histochemistry in Cameroon in most hospitals. We're able to do it in one hospital, that's Central Pasteur. If you want to know the ER and PR status of a breast cancer. So think about it. So we need engagement and we need investment into it. It's something, and we need training. If we want to do these things, we must not always send them to France for it to be done. It's costly, and at a certain way, it's not going to be able to be sustainable over time. If 80% of patients who are diagnosed with breast cancers in Cameroon are unable to know their progesterone and estrogen level, which is the fundamental part of treatment. Same thing with matching. Matching is a complex process that needs to be done by technicians that are well trained. You need to train them. I think training is not going to be a problem. Cameroonians are very educated and they are ready to learn. But the government needs engagement, or someone in the private who has money and wants to put money into that aspect of it. And then you need to also train the culture of the people to be active donors. Even when we migrate to Europe and Africa, we are not part of the donor pool. We just refuse to be part of the donor pool. It's not part of our culture.
Yeah.
And we need to start talking about that.
Yeah, thanks a lot, Mono. I hear you. You can proceed with the question you had for Iya.
Yeah, my question to Iya was concerning the blood. I saw one of your projects coming forward. I want you to tell us more about it. The blood donation, how is it going to work? I think it's a very important problem because you made allusion to a lot of things that kidney patients go through. It's not only about getting dialysis. A lot of them are chronically anemic.
Mm-hmm.
And getting access to erythropoietin, you said, is a big problem in Cameroon. You need to be financially capable to do that.
Yes.
Now, how about the blood donation in Cameroon is a problem because you need to bring donors in order to get blood.
Right.
So how does this project why are you planning to execute this project? And how can we support this particular project, which is issue of anemia in these patients? And the second question will be about mental health. What has been your experience trying to provide mental health to kidney patients? Thank you.
So if you don't mind, I would like for the people who are working on the ground to answer that question. Jude has been very proactive in doing all the research for, Jude, are you here? Mr. Wenka? It has been very instrumental in doing the research for the blood donor safety program. So like I said, we're gonna be collaborating with Lifeline. It's another nonprofit organization out of Texas, but also has a branch in Cameroon. And it's a partnership between Lifeline and the General Hospital Boya. So Lifeline and the EA Foundation are gonna collaborate, reach out to the community. We've already started sensitization. Well, we plan to go out to different institutions and schools and collect names. First of all, we're going to sensitize about blood donations, and then we register interested participants, schedule a day when we're all gonna meet at the Boya General Hospital, where the blood is going to be collected by trained phlebotomists, of course, at the hospital. And the hospital is gonna be in charge of cleaning the blood and all that, and also storing the blood. So, and then the hospital is also gonna benefit 30% of the stock. That's the collaboration that we have with the hospital for this particular campaign, so that it becomes a win-win situation for everybody. So I'm not sure if there's any other information that you need. So far, we have funding for the first quarter of the program, of the project. We hope that it's a project that can continue because, of course, unfortunately, dialysis is not appendix, where it's a one-time surgery and you're probably back to normal, or cataracts where they do a surgery and take out the cataracts and you're fine. Dialysis is lifetime. If once your kidneys fail, you're gonna have to be on some kind of renal replacement therapy. Either gonna have to do dialysis, whatever mode of dialysis you do in Cameroon. They mostly do hemo. Over here we do home hemo, peritoneal, and all these other ones. We now have transplantation. You know, the more transplantation we get, the better. But for now, we're gonna stay on dialysis. And of course, with dialysis, we have its sister, anemia, chronic anemia. So no matter how much blood we raise, we're gonna run out if we don't continue to run the project. So the project, we're hoping, is going to be ongoing. For now, we're able to fund it for at least a year. We haven't started, we're kickstarting it this month, this June, which is sensitization, and then scheduling for collection of the blood. So that's where we are.
Yeah, awesome. Jude, did you want to add anything else?
Oh, Jude is here. Jude, that's your project. Jude has done a lot of research. She has gotten all the authorizations for us to be able to collect blood and all that. So Jude, if you have anything to add, please, by all means. We can't hear you. Is Jude?
Yeah, maybe we'll come back to Jude later on.
Greetings, good evening to everybody. Good evening. I don't know if I can talk through Mabel's phone, through Mabel's Zoom.
Sure.
Okay, thank you very much. I believe my network should be having some issues, and like the last speaker before Madam Iya talked, it's really difficult getting donors as far as our African context is concerned. So we'll really need to do a lot in order to sensitize these people, to get those who will be willing to donate as well. And from what Madam Iya has said, I was unable to really get her clearly. Unable to get her clearly. So so that I shouldn't be repeating what she has said already. I think that is all I will have to say about it.
That's okay, Jude. You can say.
Yeah,
Okay,
that's fine.
okay.
That's fine. She elaborated on some of the projects you have going on and your leadership in leading some of these efforts locally. So I just wanted to find out if you had some additional comments or remarks regarding that, but we can still come back to that later on. I wanted to take Sam's hand was been up. Sam, you have the floor.
Thank you very much. I want to commend Iya and the entire team. And as Elvis already said, when you take the patient-centered approach, it's always the best. Listening to her talk about the food security program, the mental health, and also the green campaign, that is really wonderful. And I just wanted to jump onto the blood campaign. And if I would love, we have done blood drive campaign in Dub. As Jude mentioned, I was curious to hear blood bank is a serious issue in Cameroon. I know I heard Ms. Iya talk about storage, and I would love to hear from Jude what is actually the plan, in their program that they have, how long can you store the blood? Because we know electricity is a problem. Having a good refrigerator system storing those blood is also a challenge. So that's my first question. And the second question will go to Iya. I heard she talked about actually drawing labs or having a kidney patient come to their resource center for checkup and for testing. But she mentioned that many of them always have challenges coming because of restriction. And I think I posted a question on the chat group. Is the restriction coming because they have hospitals or centers they are dealing with that they are not giving them the opportunity to come to the resource center? Or what kind of restrictions are they having? Thank you.
Jude, you want to start?
Yes, madam. Let me just start. Okay, so thank you very much for your question. I will start with answering the question with respect to the storage of the blood. That is one of the major issues we're having as far as this blood safety project is concerned, how we're going to store the blood. And that is why our partnership with the regional hospital blood bank is coming of help to this particular project. Even though the blood bank is not willing to bank the blood, that is being willing to recycle this blood in such a way that if we are having like 100 pints of blood, we just know that we have 100 pints of blood and until the pints get finished. But the system in which they want to do it, they are just offering us a storage device, like a blood bank, a storage device in which we store the blood and we're able to use it for might be the 35 days. It is 5 days that a pint of the blood can last, the lifespan, the blood can last. And after that, if there is any, if we cannot finish it, the rest, they don't know what to do with it. They don't know how to do with it. So if we had an opportunity in such a way that we could have somewhere where the blood can be banked in such a way that it can be recycled in such a way that if the hemodialysis patients are not using it, they can use it for other patients. And when they have their different donors, they can be able to replenish the ones they have used. But they gave us a condition and it's like they cannot do it that way. So whatever we want to do, they will just give us a storage site and anything that concerns it goes for the hemodialysis patients. And that is our major challenge, one of our major challenges with respect to this project.
Thank you very much, Mono and Elvis. That's another area that I've actually gone right up to the Center for Disease Control in Yaoundé and Santo Pasteur, trying to find out more on that. That is a huge challenge, the storage for a longer time. And then the second point that you have, many people will only donate, which Mono has mentioned multiple times, when you compensate them. We have done 3 campaigns and it is hard to find anybody to come and donate when you have not given them something what they call motivations. So are you people thinking about that? Because that we have tried. Yeah. Yes,
it is.
Okay.
It is incorporated in our budget.
Okay.
Yeah. And it's really important that I'm just talking from a hematology point of view. Being a hematologist, it's important that we get to a culture where we can really get our people to donate blood freely, where we can get a situation where we can actually separate the red blood cells from serum, which is important, so we can be able to store it for a longer period of time and get other components which are difficult to get, like platelets in Cameroon, even getting sera and then getting red blood cell concentrates. Those are all things that I think is a discussion really with the ministry. Another day, we need an advocacy group where we can get to that point where you can store, because if you have just red blood cells, you can store them for 42 days at 6 degrees Celsius, which is different from getting serum mixed with blood. The lifespan changes. So all these things, platelets are not able to store for a long period of time because they get infected. So all these things are part of it. That's just part of my training because I deal with that. But all these things are so important that I don't think the ER Foundation can answer all of it because it's more complex and you can do what you are able to do. And as Jude said, it's so important that if you're bringing blood to the hospital should be able to use that blood because they don't have it and be able to actually put back into the pool so that they don't replace it. So it's an MOU that you guys, we need to talk about it. And I don't think we need to be very stiff when it comes to, unless there are policies in place that makes things difficult. But it's something that you may have to really rediscuss it with the director and all those who are involved administrative wise. But what you guys are doing is a great project. That's why I actually wanted to ask questions about it. So let me give the floor over back to, I don't want to take all the time, to our moderator today, Dr. Brian Tegomo, please. Over.
No,
Let
thanks.
me answer Mr. San's second question. Thank you for that response, Jude. So in reference to, it is actually the administrators that are restricting patients from coming. And apparently what we found out was that there are some, medics that have partnerships in local labs. And so they would rather the patients go and endorse or patronize those labs, because at the end of the day, it's making money for them too. So that's what we were told on the ground. So that's the politics on the ground. Yeah.
Thank you.
You're welcome.
Very helpful. Thanks, Iya. Kate.
Please. I just want to add to very, I don't know if I'm going into unfair details here, and we know the devil is always in the detail. You talked about using a point of care instrument to assay or to analyze creatinine, and then to calculate the eGFR. And my question was, I don't know if this point of care instrument has been validated, because it's important, since your team is using this in most of your screening campaigns, and just really to make sure that what you're getting from this point of care instrument is actually in agreement with what we would get from serum creatinine from the standard laboratory procedure. I think that's something that I'm sure your team on the ground, if it has not been done, they can easily do that, just to add some level of robustness to what you're doing.
Yeah, okay.
Yeah, maybe you can permit me to jump in here to talk about that, because
sure. After you, I'll go.
I know the point of care device that she's talking about is called Nova. It's produced and manufactured by a very renowned biomedical company called Nova Biomedical, and it has a CE certification, and it's being used globally. Presently, they are doing a lot of work around the globe, and I think that's the only point of care device for the for creatinine clearance and eGFR, as far as I know now globally. And so they are doing a lot of work to promote the use of this point of care device for early detection of CKDs. And I'm partly involved with a pilot that is, we we just finished writing the protocol for that pilot to be done with Dr. Gobina, a nephrologist at Eboya Regional Hospital. And we're going to do another pilot on just community-based screening and how effective that can be using these CKDs. And during the validation process of this point of care device, I think some samples also from South Africa were used. So it was not just validated with samples from the North, but also African population too. So it's a well-validated point of care device that is really being promoted globally. In Egypt, they have more than 5 million people have gone through screening using this point of care device already. And so I think it's a very good innovation for us. And right now, it's not just a point of care device now, but there is a digital health platform called Kana Health that is working in partnership with this point of care device to ensure that as you prick yourself and get the blood drop to get the results, there is a Bluetooth device, Bluetooth technology on that device that can actually uptake your results and land it on the database of your provider without you being in the office of your provider. So you can actually test for your creatinine in your home, and your doctor in his office with the app will be able to see the results and be able to direct you for your care. So it's a very innovative technology and also digital health platform. They are doing it in collaboration, which I think is a game changer for early detection of CKD. So yeah, I wanted to say this because Dr. Ekiti and I had a conversation about this yesterday, and I know he is of the Gray Lab and had worked with you on this project. That's why I wanted to take the pain off you to explain this. Thank you.
Yeah, thanks a lot.
To Dr. Kate, this is actually we haven't used it. We actually would use the Albu sticks for a lot of our testing, the urinalysis sticks. The first time we've used this is this March with the Gray Lab. So
Yeah, I saw that Martin was here earlier. It looks like he may have left, but it would have been great to hear his insights a little bit on some of the diagnostics. But I do agree with Elvis on the need for innovative diagnostic tools for CKD. That's really going to help with early detection and things like that. But I think more importantly, we really need to have a better understanding on what the epidemiology of CKD is in Cameroon, and really what the major risk factors are, what's driving this rise in incidence in CKD. So we definitely need more collaboration, more research between, hospitals and academic institutions and research organizations and things like that, because we have to better characterize what's driving really the major drivers of, those risk factors, so we can, have enact policy changes and decisions that can help to address some of those gaps for sure. And also congratulations for your work across Africa. I saw your slide on the collaboration with Nigeria and Ghana and other countries, and I think that's really powerful and really impressive. Just
to follow up, I don't know if you're done. I'm sorry, before it escapes me, I think it was you, Dr. Brian or Dr. Kate, but about if we are comparing with clinical lab results versus the point of care results, that's actually why we have that follow-up, the post-green campaign, where we were going to pull back the high risk participants and actually draw lab and do it through our draw blood and actually do it through our lab and compare results. And one of yours, Dr. Guy, he's actually the one that has always analyzed our data. So we also have data from scientific data from past campaigns, and he's actually working on the one from March. We should be getting it soon, and we might be able to share it with you guys.
Yeah, thanks. That's very helpful. I think we've had the round. We'll try to round up now. We always have a parking lot at the end of the session to discuss more. So I just wanted to maybe have a very quick round with the other moderators as well. Final thoughts and reflections regarding this topic. And I think I can start with Elvis. I don't know if you have any closing remarks and thoughts.
Well, no, just to say a big thank you to Iya Bekondo for the amazing work she's doing in Cameroon and in Africa, and to say that you have all our encouragement at the level of the Cameroon Town Hall for Healthcare Professionals, and that we're going to see how much contribution we can always bring to you. Keep us on the know each time you have a campaign, and we can always be very happy to support your work. And if there is anything that at the level of the town hall, we can reach out to our community of 1,800 people to let them know about whatever thing you're doing, you can always write to us, communicate, and we can help share it on our platform that we are sure will reach out to 188,000 people. Or 1,080 people, 800 people on our platform. So I just think that the town hall is here to support you as you hear more from the chair. This is a very important topic. It's also, I'm very concerned about it too, because recently I've been very engaged in CKD early detection programs across Africa. As I mentioned earlier, I was in DRC working on that. Now we are presently working on this pilot in Cameroon, and also I'm involved with some work in Bermuda. So I think it's something that I'm also really working hard to see, that we shouldn't wait until patients get on dialysis before we start thinking about taking care of them. There is a very interesting paper, which unfortunately I didn't have the chance to share here, which was done by Mackenzie and Institute on CKDs in Australia, that demonstrated just how much economic gain a country can make if they invest in early detection. Detection. So if you look at also following Brian's question about causes, more research to be done, there is also another LMIC paper on CKD, which if you want to, I'll share that paper with Brian. You see exactly some of the thoughts and hypotheses about why the population that is having CKD in Africa is a youthful population, and also why we think that instead of the fact that, hypertension and diabetes are less in LMIC than in developed world, but we are having an increase in CKDs in LMIC. So there are also some other suggestions that factors such as environment could and climate could also be contributing, considering that research shows that those who work for longer hours out of their home under the sun can also be at risk of developing CKD due to dehydration. So I think there are so many other hypotheses, and also those who are on medication, like those on antiretroviral drug and other chronic disease. So I think that more research is needed. It's a call for researchers in the house to pay attention to CKD. So thank you for throwing the light on this important disease, Ian. And it was a pleasure being here. Brian, over to you.
Yeah, thanks a lot. Looking forward to the McKinsey paper. Kate, over to you.
Yeah, thank you so much, Brian, and really big thank you to you, Ia, for your presentation and for giving us insight into the work that you and the IA Foundation are doing in the US, in Cameroon, and in other countries in Africa. I think we've learned, that patient perspective approach to solving problems from your presentation today. We've also learned that you in your team, you're putting in place, some rigorous processes to make sure that you obtain, robust data, which I think from a scientific standpoint is very, very useful, so that we don't just go into communities and do things and get out of these communities, but, try and make sure that we are able to accurately document whatever we are doing in the best possible way. And I think you, Elvis and Brian, you talked a bit about the drivers. And I mean, Elvis, you've mentioned that paper that says is out of the, the traditional drivers for CKDs, there are lots of other drivers which we do ignore in our setting, which are contributing to increasing the prevalence of CKD in developing countries. I think we should really pay attention to this. And just to end with the point of care, it's very important that for most of these devices that are fabricated in developed countries, and usually when you bring them to Africa, where the temperature is different, where, for example, you are in Buea, the altitude in Buea is very different from the altitude in other places like Yaoundé and Douala. So those changes. So, I mean, we should always think about doing those small validation studies, which I think Elvis has mentioned that they are doing, and that some of your team also will be doing. So it's very important. That shows and really the kind of completeness to what your team is doing in the IA Foundation. And we thank you for that patient-centeredness in your approach as well. So it's been a lovely presentation. Thank you so much.
Thank you. We've worked with you. You've always been there to support us when we're in Yaoundé with our volunteer pool. So definitely grateful always. And for a research topic, just to throw it out there, since you guys are all medics and probably do stuff like this, I've always wondered where dialysis patients in the US have a minimum of at least 3 days of dialysis and more. A lot of people now do dialysis daily with the implementation of home hemodialysis, and even peritoneal, you do it daily. So a lot of patients are starting to do dialysis daily at home. But in Cameroon, patients go 2 days a week, and sometimes for longer periods of time in between dialysis. Now, I was also at a kidney conference where there was a researcher who had who was trying to present the fact that, or the theory that patients could reduce the time that they spent on dialysis if they had controlled sauna treatments where they would be able to sweat out some excess water and toxins through their skin. So by using those sauna treatments, they would be able to reduce their dialysis time and so not have dialysis weigh so much on their body. Now, my question is, with the climate in Cameroon, let me say in Buea Southwest, where sometimes I know Buea is relatively cooler compared to Limbe, but it gets really, really hot sometimes too. Would that be the reason why maybe patients are able to get by on just 2 dialysis treatment a week, because if I go for 2 days a week, I know if I skip a treatment, it takes a toll on me significantly. My body tells me. So I don't know how the patients are able to go for years. I know patients that have been on dialysis in Boya for 8 years. Mr. Tambe, late Mr. Tambe, he was very active with us. God bless his soul. He died. He was on dialysis for about 10, 11 years. So I just don't know, maybe that's something with the climate, or it's just that the body adapts to the 2 days a week. And that's why a lot of patients are always looking so sick or look sicker than the average dialysis patient here in the US. I don't know, but that's
I think you're just hitting the point, and that would be probably a good discussion for the parking lot, I guess.
Okay. Okay.
Yeah, thanks a lot, Iya, for that.
Yeah. Thank you guys so much. And I hope that you guys will continue to partner with us in the future, or call us. Dr. Ndasi, you can call us if you need some people to do some of the homework for you guys. So
yeah, for sure. Yeah. I just wanted to take some closing remarks from the chair of the town hall, Dr. Mono Foma.
Yeah, Brian, thank you very much. And I just want to thank Iya for her time and for what she has been doing all these years. And for you not to relent your efforts. I think you have been a voice. We need a lot of patient voice in this, in the field of health, so that we can hear really from what patients feel, how the field change can come across. And you have been that patient's voice. And you've had a lot of interesting questions. You've done philanthropic work while doing it, doing research alongside and helping patients in the real definition of health, both medically, clinically, psychosocially, and also holistic approach in the way you're doing what you're doing. And I happen to have done a little bit of research in Cameroon on chronic kidney disease when I was doing clinical pathology. What I found out in this, I did a lot of research in the Northwest and in Santa and Bamenda, and we realized that the cause of dialysis itself at the time, HIV was #1 in the Northwest region. There was also hypertension. There was also, other than hypertension and HIV, you also had diabetes. And those were things, but there are several studies, as many people have made allusion to, which we're going to talk in the parking lot, really getting to exposure to sunlight. There is really a big question. Why are Blacks more prone to having chronic kidney disease, even after doing complex analysis and taking away all these other risk factors? There is actually a theory behind that about the renin-angiotensin system and how we adapted to sunlight. That's actually, it is going back to my internal medicine discussions, which is a whole theory we can say, because you take out every factor, you give a Black guy, a white guy, hypertension, diabetes together, follow them over time, the Black guy is going to get to dialysis first. That's adaptation.
Does it have something to do with the Apollo gene?
So, yeah,
1 gene?
It has. And it has something to do with genes. It has something to do with epigenetics. It has something to do with our evolution to adapt to the climate which we grew up in, and also parasitic involvements with schistosomiasis and other things. It's a complex discussion that you could see papers which were published in Nature, but this is not a discussion for here. But thank you very much, Brian. And just want to thank you for your time. And I also want to actually plead for collaboration with the EA Foundation, those who are here. They are doing wonderful things. If you can support them, if we can get partnerships that we can actually promote the different activities you're doing, that would be great. So I look forward to, as I told you, engaging and collaborating in 1 or 2 of your projects going forward.
Yay.
And personally, that's a personal engagement, and also the town hall. Okay, thank you very much. Brian, over to you.
Yeah, merci beaucoup. Thanks a lot, Mono. Thanks a lot for those remarks. And also thanks a lot, Iya, for sharing so much about your work in Cameroon as well. I want to pass over to Elvis, who is going to close us with the town hall, and then we can have a parking lot discussion. But I also wanted to just draw your attention to the message that was put by Dr. Manzi in the chat. He's asking for your contact to see how we can possibly collaborate with you, or maybe you guys can discuss some things.
Okay, thank you.
Elvis, over to you. Yeah.
No, thank you so much, Brian. I think you already did the best of the wrap up for this session today. I just want to thank everyone, ladies and gentlemen. If you were with us today, you would notice that our guest was Bekondo, and our topic today was chronic kidney disease, looking at education awareness and also early detection, as well as transplant. So we want to thank our guest speaker for enlightening us on this very important topic. And ladies and gentlemen, all of those of you who have been in from the start of this session till now, I want to thank you for spending your Saturday with us. And it's always a pleasure to see you here. Next, we shall be meeting in 2 weeks' time to have yet another very interesting conversation with you. This is the Cameroon Town Hall for Healthcare Professionals. Thank you for coming. I wish you a very nice weekend.
You too. Thank you.